Today I will be dealing with the Introduction to Nursing Research and the related multiple choice questions, which may be helpful for your competitive exams.
Let us see what is research. Research is a term which is derived from the French word research, which means to find or to search. Now coming to its definition, research is an investigation which is done scientifically, systematically, orderly and in a controlled manner to develop new knowledge, to refine the existing knowledge and to expand the knowledge. The second definition which we have is that it is a systematic inquiry which uses disciplined methods. So here what we need to focus is it does not use any random methods, but in short it uses a discipline and a proper method to answer the questions or to solve the problems. So from the definition itself we got the characteristics of research, that is, it is scientific in nature, systematic, done in controlled and orderly manner. It is logical and objective, directed to solution of problem, carefully designed, etc. Now coming to what is nursing research. It is a systematic inquiry or investigation to find out solutions or to develop knowledge in the field of nursing practice, nursing education, and nursing administration. I have a question. Which of the following is not true about the characteristic of a good research? Option A, begin with clearly defined purposes. Option B, finding solution to a problem. Option C, conducted using large amounts of funds. And option D, orderly and systematic. And the correct answer is option C, conducted using large amounts of funds. Option A, B and D are the characteristics of a research, whereas option C is not a good characteristic of a research. Next question. As a professional, a nurse can do research for varied reasons except option A, to validate the results of new nursing modalities. Option B, professional advancements. Option C, to improve the nursing care. And option D, for financial gains. And the correct answer is option D, for financial gains. The research is always done, as I told, to refine the knowledge or to expand the knowledge or to use the findings in the improvement or in the advancements. But it is never done for any financial gains. Knowledge of nursing research enhances the professional practice of all nurses, that is, the consumers and the producers. So sometimes nurses becomes consumers and at times producers. Let us see what is a consumer and producer here. Consumers are those nursing professionals who read, evaluate and use the research and its finding in their work area. Whereas producers are the nursing professionals who design, undertake and conduct the research. We have a question here. A nurse who reads research articles and incorporates the research findings into clinical practice is A. Option A, collaborator. Option B, co-investigator. Option C, primary investigator. And option D, consumer. And the correct answer is option D, consumer. Let us see who is the pioneer in nursing research. Nursing research began with Florence Nightingale. Nightingale's initial research focused on the importance of a healthy environment in promoting the physical and mental well-being. And this research was published on Notes on Nursing in the year 1859. For conducting the research, during the Crimean War, she collected the data of increasing mortality and morbidity among the soldiers. And then she analyzed the data to get the solution. So Nightingale's main contribution in research is data collection and analysis. In the year 1986, National Center for Nursing Research was established in USA. A question here. Who is the first nurse researcher? Option A, Martha Drogos. Option B, Sister Callista Roy. Option C, Dorothea Orame. And option D, Florence Nightingale. And the correct answer is option D, Florence Nightingale. Now we will be seeing the methods of acquiring knowledge. So for acquiring the knowledge, we have different methods. The two main methods of acquiring knowledge is the structured or formal method, and second is the unstructured or the informal method. So as I told you that we have the structured method, which is also known as the formal method. In this we have mainly three types, that is a logical reasoning, problem solving technique, and by conducting research we can acquire knowledge. So what is basically a logical reasoning? Mental processing of ideas to solve problems or to find out solutions is known as logical reasoning. Logical reasoning is again of two types, that is inductive reasoning and deductive reasoning. So in inductive reasoning, we move from specific to general observations, whereas in deductive reasoning, we move from general to the specific observations. Now moving to the unstructured method or the informal method. So we have examples are tradition, authority, by one's own personal experience, trial and error, and sometimes intuition, which is also known as sixth sense. All these are the methods which comes under the informal method, which helps us in acquiring the knowledge. Question: which of the following is an example of inductive reasoning? Option A, using a standard nursing care plan for a specific patient. Option B, reasoning from all hypertensive patients to a single hypertensive patient. Option C, reasoning from a single depressive patient to all depressive patients. And option D, all of the above. And the correct answer is option C, reasoning from a single depressive patient to all depressive patients. Because as I told you that in inductive reasoning, we move from specific to general. Question: the deductive approach in writing protocol involves option A, moving from general concept to a specific one. Option B, moving from a specific and then expanding to the overall plan. Option C, moving from precise to wide-ranging. And option D, moving from meticulous to specific. And the correct answer is option A, moving from general concept to a specific one. So, as I have already told you about the deductive reasoning and in the deductive approach, we always move from a general observation or a general concept to a specific one. Moving to the next question. The process of drawing a specific conclusion from a set of ideas is known as option A, inductive reasoning, option B, deductive reasoning, option C, idealism, and option D, logical reasoning. And the correct answer is option B, deductive reasoning. So here a set of ideas comes under a general conclusion or a general observation. So when we are drawing a set of specific conclusion from a general conclusion, then it becomes a deductive reasoning. Now let us see the different types of research. On the basis of purpose, the research is divided into basic research and the applied research. So let us first of all see what is basic research. Basic research is also known as fundamental or pure research. In this, we gather and generate information, and the main aim is to expand the body of knowledge, to improve understanding about a particular discipline. Thirdly, this type of research is used to develop or refine theories and principles. Now coming to the second type of research, that is applied research. It is done to serve functional purposes and for practical use or application. Its main aim is to find an immediate solution to the problems. We have seen that on the basis of purpose, research is divided into basic and applied. Now on the basis of approach of studying the variables, research is divided into two, that is quantitative research and the qualitative research. So let us see what is quantitative research. It is an investigation or an inquiry into a well-known problem which is based on testing a theory. This theory may be made up of variables. So these variables are then measured with numbers and analyzed using the statistical methods. In this form of research, data is collected in the numerical form. We have three major types of quantitative research, that is the non-experimental, experimental, and the quasi-experimental research. Again, the non-experimental research is further divided into descriptive research, exploratory research, and the correlational research. So, as I told you that on the basis of approach of studying variables, the second type is known as the qualitative research. In this type of research, a deep understanding of human behavior is done, and we try to find out the reasons behind a particular human behavior. In this, data is collected in descriptive form and analysis is done by descriptive coding, indexing, and narrations. Let us see a question here. A researcher investigates the effect of foot massage on sleep quality of patients. The study would be described as option A, basic research, option B, applied research, option C, descriptive research, and option D, phenomenological research. And the correct answer is option B, applied research. Next question is, there is a research question which states, does motivational counseling before discharge by nurses improve patients' compliance with their drug regimens? So, the option is A, basic research, option B, applied research, option C, descriptive research, and option D, phenomenological research. And the correct answer is option B, applied research. The major objective of conducting a basic research is to A, develop theories and principles, B, develop knowledge for immediate use, option C, make a decision, and option D, provide a solution for existing problems. And the correct answer is option A, develop theories and principles. Here, option B, C, and D are the characteristics of an applied research. Next question, which of the following is the characteristic of a qualitative research? Option A, application of statistics for analysis. Option B, generalization to the population. Option C, random sampling. And option D, unique case orientation. And the correct answer is option D, unique case orientation. A, B, and C options are the characteristics of a quantitative research. Question, which of the following type of study is an example of qualitative research? A, survey design, B, ethnography, C, cross-sectional studies, and option D, correlational studies. And the correct answer is option B, ethnography. Question, quantitative research is a process to A, obtain feelings and beliefs of the people, option B, describe lived experience of people, option C, evaluate theories and hypotheses, option D, develop theories and hypotheses. And the correct answer is option C, evaluate theories and hypotheses. Developing theories and hypotheses is an example of basic research, whereas option A and B are the characteristics of a qualitative research. Question, a study of experiences is called option A, ethnography, option B, phenomenology, option C, grounded theory, and option D, action research. And the correct answer is option B, phenomenology. So phenomenology is a type of study in which human experience is examined through the descriptions provided by the people involved in it. Next question. Applied research seeks to solve a clinical problem in option A, laboratory setting, option B, simulated setting, option C, natural setting, and option D, controlled setting. And the correct answer is option C, natural setting. Thank you for watching. For more such videos, do like, share, and subscribe to our channel Nurses Handbook. And if you have any doubts, please drop it in the comment box. We will be happy to answer you.